Hi, this is Tessa Hale, and this is my strategic plan presentation. Nutrition is Elementary, Building Foundations for Lifelong Health in Schools. This is a comprehensive initiative that takes both policies and programs to address childhood obesity and increase healthy eating behaviors in elementary school kids. This initiative takes place in my home state of Colorado, which is considered the leanest in the country. It's been battling at this position with Hawaii for several years and currently holds the honor. However, as great as that headline looks, when you look at the subtitle, you see things aren't all that rosy. 1 out of 5 Coloradans is considered obese, and 2 out of 5 are overweight, so the majority of Coloradans aren't maintaining their weight. The statistics for kids are even worse. 1 in 4 Colorado kids is obese, and in 2008, Colorado was one of 3 states in which early childhood obesity increased. What we see is that we need to address obesity across the board, and we really need to focus on children. Not just because of the increasing rates of obesity, but also because if we can teach kids how to eat and live healthy, we have the opportunity to break the cycle of overweight and obesity. Now, drilling down to Boulder specific statistics, which is where the program will be, Boulder County childhood obesity rates have doubled since 2003, which is an alarming and disturbing statistic. Nearly 1/4 of children ages 2 to 14 are overweight or obese. So what are the different factors that are contributing to this problem of overweight and obesity? Sugary beverages are a major culprit in the obesity epidemic. Sugary drinks are the largest source of added calories to the American diet, and they have no nutritional value. Just 1 sugary drink a day increases a child's risk for obesity by 55%, along with a whole host of other terrible health consequences. In Colorado, 20% of kids 2 to 14 are having 1 or more soda a day. And this also is a health equity issue for us. The beverage companies disproportionately market to communities of color and kids of color, and we see that playing out here in Colorado, where 30% of Latino and African American kids are drinking 1 or more sugary drinks a day as compared to only 15% of white children. What else can we do? Well, an apple a day keeps the doctor away, as we know, and that's actually 5 servings of fruits and vegetables a day that we need to really maintain a healthy weight, along with also ward off heart disease, high blood pressure, stroke, and a whole host of other health issues. Shockingly, in Colorado, 93% of kids are not eating the recommended 3 servings of vegetables and 2 servings of fruits a day. We really need to focus on this and work on getting kids to increase their fruit and vegetable consumption. The goals for this program are to increase fruit and vegetable consumption, decrease sugary beverage consumption, create awareness of the need for healthy eating and its impact on the body, to create efficacy around healthy eating and break the cycle of unhealthy diets, and finally, to create an environment that supports healthy eating for kids and their families. What I would like to see is a nutrition education policy that fully integrates the health education into the curricula, such as in San Francisco Unified School District, where they have this kind of policy. A similar policy in BBSD would ensure that elementary school students learn about healthy foods and eating, including what the healthy foods are, how to prepare them, how to eat them, and the impact of food on health. And this would all align within the Common Core. This is called Food is Elementary. This program was developed by the Food Studies Institute, and it teaches nutrition and cooking skills for elementary students. The lessons integrate a variety of studies including math, language arts, geography, PE, science, history, art, and as I mentioned, they meet the Common Core standards. And as you can see here, there's positive feedback from students. This program has been implemented in different places across the country and has astounding results. In South Bend, Indiana, the evaluators partnered with a grocery store where they saw an uptick in the sales of the various fruits and vegetables that the kids were learning about. So the kids were actually going home and asking their parents to please buy these new fruits and vegetables that they were trying at school, which really has a ripple effect where kids are bringing their families into this new idea of healthy eating. In order for this initiative to be successful, there are several stakeholders that we need to bring in to support our work and implement this program. First, the school district leadership, the superintendent and school board and their staff, and the principals all need to be on board with this. Additionally, we need the teachers who will be implementing this in the classrooms. We also want the parents involved, both as champions for the program and to support these healthy efforts at home. We want the parent-teacher organization and community members to help us out too. And finally, we also are fortunate enough to have the University of Colorado, which is a public research university here in town, and they have undergraduate and graduate programs in food science, human nutrition, and dietetics that could partner with us both to evaluate how effective this program is and also to support the implementation through teaching nutrition education and other initiatives that we have related to this. In order to make this initiative a success, there are other programs and policies that I would like to put in place to create an environment that's supportive of what the kids are learning in the nutrition education classes. One would be a healthy celebration policy that eliminates junk foods and instead promotes physical activity or other non-food rewards as a way to think of shifting food as the primary way of celebrating into other ways of coming together and having fun. So kids for a birthday party could opt for extra recess or fun birthday pencils. Or if food is served, it could be fun, creative, and healthy, such as this rainbow of fruit you see. The Boulder Valley School District has a wonderful food services program. It's really unique, and it calls itself the School Food Project. We're really fortunate to have the different kinds of programs, initiatives that they offer, and we would collaborate with them as these initiatives support the work that we're doing in the classroom. One initiative is the Harvest of the Month. It's a nutrition education initiative that introduces the concept of seasonality and new fruits and vegetables. It's promoted through the school lunch calendar, posters in the cafeteria, recipe cards, and incorporated into the school lunch menu. Tastings happen to further encourage students to try the monthly produce selection throughout the year. So each month, the students have an opportunity to try something new and have a recipe that they could bring home to try with their parents. There's also an Iron Chef competition, just like the one that's on TV, except for kids. The elementary school students compete in a healthy and delicious after-school snack competition where they're provided a list of ingredients that has to use a grain, protein, fruit, or a vegetable and create a snack in a 30-minute time frame. And finally, Rainbow Days, which is where volunteers go to elementary schools and invite students to make a salad from the salad bar and try new fruits and vegetables. During this time, lessons on the benefits of fruits and vegetables and portion control are taught. All kids who try a salad receive a sticker that says, "I tried a rainbow," and the kids proudly wear them. Our end goal is for super healthy kids. Through implementing policy requiring nutrition education at all elementary schools, we ensure that each child has the opportunity to learn why and how to make healthy food choices. Food is Elementary is a nutrition education program which has been proven effective, so BVSD could begin implementation as soon as the policy is passed. Creating a school environment that supports these policies, such as the Healthy Celebrations policy and the food services programs that promote healthy eating, reinforce the lessons learned in the class. Through these policies and programs, the kids of Boulder have a chance to turn around the current statistics and become the generation of health.